Alright, so here what I'm doing, I already cleaned the area, and I'm putting some numbing medicine. Usually it's lidocaine with appy.
Okay.
The lidocaine to numb, and the epinephrine kind of vasoconstricts the area. We're gonna do the injection.
Okay.
So the entry point, I mean. So we'll see. That's good. And then just clean again. So the area we have the blanching is the area we have the numbing. Should be numb now. Go a little bit perpendicular because I want to bypass the muscle, go everything kind of deep.
Okay.
So when I'm doing the under eye filler, the main complications people are not experienced doing this is that they put it either too superficial, or they put a lot of the filler in the area, you know, because all the fillers will absorb water in this area, so it can't underfill. Okay, I'm gonna just, okay, here bypass the muscle, and then I go in the direction. Have to be gentle. If you have resistance, walk it over the bone and then redirect if needed.
Okay.
Okay, you're okay?
Yeah.
Perfect.
I don't feel much of anything, so.
Perfect. Good. Alright, here you see.
Yeah,
so
I
I kept
feel
like
that.
doing advancing until I found the path, and now it's good. And I can feel the tip of the cannula all the way. Okay, so I have to stop there. And then I change the direction, kind of tend up. So this way I keep the tip of the needle kind of low and deep. Okay. So then I start injecting very slow, and I'm not looking at how much I'm injecting. I'm injecting slow, but I'm looking how it's filling. Okay, you see it's filling good. Okay, and then a little bit more to the corner, and I'm aspirating. I'm not sure if you can see, but no, you know, all that stuff will help it will decrease the chances of any complication. So different things I'm doing at the same time. I'm aspirating, there's nothing there, so that's good. Let me just come out. That's already look way better. And let me just go again. And a little bit pressure under the muscle. Okay. Up. And aspirate again. Again, keep in mind that whenever you're doing this, is that gonna absorb some water. So 0.6 already. So that's kind of 40% of the syringe. I should stop here. Yeah, the little hollowness a little bit to the side. The same thing, I go a little deep. And I know the direction is away from the eyeball, but if I'm getting close to the eyeball, of course, I have to be very careful and protect the eyeball with the finger. So, okay, here, you see here, for example, let me just find the tip of the needle first, or the cannula. Protect the eyeball. Okay, I feel the tip, protect the eyeball a little bit. We're almost done with this side. Okay, and then massage it a little bit. How is it so far?
Good.
Good.
Yeah.
Okay, good.
No pain, it just feels weird.
It does. Yeah, that's exactly as I explained to you.
I can feel it moving in there, but no pain.
Which you don't feel this every day, but exactly as I told you, and that's good. Some people describe it as pain, but most of the people are like you, as you said. It feels weird, it feels different. You don't have some cannula or something swimming under your eye every day, so that's why I like.
Like when you're injecting it in there, you can like feel it.
Feel it fresh. Okay, good. So very gentle, smoothing the whole area. Okay. Let me see. You could see the difference here, nice and full, and then here a little bit the deficit. So that's what we're gonna do. Again, this area is already numb, and then this is the blanched area, so that's where the numbing medicine is. So we know that this is numb, and then this is for the entry. We go with the needle, make a little tiny hole in the skin. This is because the cannula, again, the tip is blunt, so it wouldn't go through the skin. We have to do an entry point for it first. the skin, go deep, advance. Okay, is a little bit more annoying this side. Yes. So what she said now is actually, I would say, most people as well, the left side. It's okay, we'll get you through this, you'll be fine. Let me just see. Oh, here the tip is already there almost. Okay, that's it. So I always tell my patients, the left side for the most part is this is the area where the sun hits us, so it's more sensitive. It needs more fillers, it needs more botox for people who get botox, and then you have more actual sunspots, so more sunspots here. So it's all because of the sun, which shows us the sun is the factor, you know, the catalyst for all aging process.
Right.
I always like to tell my patients that aging is time, of course, genetics and the sun. So there's certain things we cannot control,
right,
which is the time, but and our genetics. But if we avoid the sun as much as possible, use really medical grade skincare products, and of course get some treatments to counteract the effects of all these factors, then you know we kind of slow and delay the aging process and look our best all the time. So as you see here, we're almost injected 30% on this side, and it's already better, but it might, okay, here it is, might need a little bit more. And here the good thing, I don't see she needs much on the side, so maybe we'll just use the whole 0.5 cc on this area. Again, I'm doing multiple things as I'm injecting, I'm aspirating, injecting slow, and I'm at the deep lane to minimize the chances of any bruising and any injection into blood vessel. All that stuff I'm taking into consideration. Okay, let me just come out. Okay, it's already also way better. And I was telling our beautiful lady here that potentially in the future, sometimes we do it after, is we fill actually the cheeks. That also gives some support, and we direct a certain type and certain direction of the filler, we direct it toward the eye. That also helps if needed. Almost done. Okay, that is good. You did very good. So as you see, she was a little bit more sensitive on the left side. The right side was very easy. The left side a little sensitive, which is again kind of normal.